Well, thanks, Callie. And I want to thank all of the participants in today's call. Steve Hobbs, Executive Director of the Missouri Association of Counties and former Missouri State Rep for the 21st District. Roy Ward, representative from Utah's 19th District in the state legislature and a practicing family physician. Kenneth Leonard, Executive Director of North Carolina's Association of County Commissioners. Wendy Sisk, the CEO of Peninsula Behavioral Health in Washington, and Tristan Tuig, an emergency department registered nurse at Providence Sacred Heart Medical Center in Spokane, Washington. So thank you for being participants in today's call. We're here, obviously, because we're concerned about the harmful effects of the Medicaid proposals in the Budget Reconciliation Act and how they will impact our communities. The current version being debated in the Senate includes $800 billion in Medicaid cuts. The nonpartisan Congressional Budget Office estimates that that would have 16 million Americans losing health insurance because of the practices and policies of this bill. Right now, we know that this is not a partisan issue. It's an issue of us basically saying, let's not cut Medicaid. This is ultimately about the responsibility to take care of constituents and our health care. And the fallout would be particularly hard on state governments. So I appreciate our colleagues from local government being on this call, because the challenges that you already face in having a balanced budget, and then these implications on top of that, make the delivery of healthcare and affordability a real challenge. Policies in this legislation hamper the abilities to states to fund their Medicaid program. They make it much more difficult to access federal dollars. And as a result, states will be forced to find ways to fill the budget with fewer resources. And the options they face are also going to be more difficult. To make up for lost federal dollars, state governments will have to consider cutting reimbursements to providers, cutting types of services, cutting people from Medicaid rolls, or raising everyone's taxes. All these decisions lead to poorer health outcomes. They increase the cost for taxpayers and strain our healthcare system. We believe all of this should be avoided. We know that the expansion of healthcare has provided more citizens to be covered by insurance, and it has helped us lower the cost of uncompensated care. Our hospitals and providers, we know in this current proposal, will bear the financial burden. So it's no surprise that without insurance, people will wait to see a provider until they're sicker or go to the emergency room at a later date, but just shifting the cost to more expensive care. At some point, their condition gets worse and also more expensive. Hospital uncompensated care will increase by at least $42 billion in the next decade because of this legislation, according to an analysis by the American Essential Hospitals. And another analysis done by a think tank, The Third Way, shows that 5.4 million Americans will incur medical debt, and total medical debt that Americans owe will increase by $50 billion. 16 billion, as I mentioned, are people that will become uninsured according to CBO, but that raises premiums on all of us because the out-of-pocket expenses of having more people uninsured and the cost of providing insurance. According to the Center for American Progress, a family of four on Medicaid making $33,000 a year could see additional $1,600 in annual out-of-pocket expenses. This is due to the implementation in the legislation of a $35 copay service, along with the cost of sharing for prescription drugs and other critical services. And a 60-year-old couple who may be in the ACA market today making $85,000 a year could see their annual premiums increase by as much as $15,000 a year through a change in the policy that affects how much people can receive in the premium tax credits. A low-income Medicare recipient also qualifying for Medicaid could also face an additional $8,340 in costs. So why are we doing this? Why are we trying to make healthcare more expensive when we know making it more affordable has helped families, helped our economy, and helped our entire system? So we need to try to shine a light on why these trade-offs make no sense for American families and our communities. So I appreciate the individuals on this call for being with us today, because they are the ones who are on the front lines of either delivering the service or making the tough decisions that will come after this legislation is passed. So now I'd like to turn it over to Steve Hobbs, Executive Director for the Missouri Association of Counties, and as I mentioned earlier, former state rep.
Well, thank you, Senator. Apologize. I'm actually on the farm today. I'm a farmer as well, and needed some help with running the skid steer today, so I'm doing that. So I'm sitting in a skid steer loader doing this call. Yes, we have concerns in Missouri. Fortunately, the state of Missouri administers all the programs for Medicaid, but where it really concerns us as counties is the fact that we have a dramatic shortage of mental health beds in our state, and our jails have become the largest repository for individuals with mental illness. We're also concerned about the program, the changes in the SNAP program, also concerned about changes in eligibility for able-bodied citizens. When they go off Medicaid and transition to private insurance, they lose their case management, which is a critical part if they're struggling with mental illness or addiction of one form or another. And then probably the last piece that is most concerning is any changes to the premium tax would have a huge impact on our rural hospitals, all of our hospitals, our nursing homes. And so we're really concerned about those changes as well.
Well, thank you for joining us today, and appreciate you being out there ready to, I'm not sure what you're processing next today, but we appreciate you helping process this information and telling people. Our further speaker down the line, Wendy Sisk, she'll talk a little bit more about that behavioral health thing. So you're right, it's going to affect our jails, our counties, and their costs. So that's why we're doing this call. So next we'll go to Ray Ward, who is a state representative from Utah's 19th district.
Hey, thank you so much for having me. I have two concerns, I guess. One of concern is just a frontline concern. So I'm a primary care doctor in my day job. Saw 18, no, maybe 15 patients this morning, and have a couple more this afternoon. On a day-to-day basis, I mean, I'm not a charity care clinic. I'm just a for-profit clinic, but I see people who benefit because they have Medicaid coverage, and who would do worse if they didn't have that coverage. Back before we expanded Medicaid here in Utah, I had a patient in her 40s who died of her breast cancer because at the time it was diagnosed was the time right when she was in between jobs and caring for her parents. And so she could not afford the follow-up, thought she was okay, but she wasn't okay. It came back and it killed her. And that just, I mean, that sticks in your mind, right? When something like that happens. I treat patients in my clinic as one of the things I do with Suboxone. So people who have troubles with opioid use disorder, and you see their lives go okay. You see them go well. You see them become stable, and you see them go badly quickly when they don't have access to that service. So on a frontline, one at a time basis, I really don't want to see a bunch of those folks kicked off. From a state budget perspective, because I sit on the committees at the legislature that tries to balance those budgets out, I'm also very worried about it. In Utah's budget right now, our total spend per year on Medicaid is $5.5 billion. That counts the federal plus the state. So our state spend per year is $1.7 billion here in Utah, about a third, probably typical for many other states. If you look at the cuts, mixing the cuts in funds that come and the cuts that are people who would be taken off because of federal funds, the total cut to Utah is about $1 billion per year on an amount where we currently are putting in $1.7 billion. So it's huge to us. It's not small to us. And that will get parsed out in different ways. Some of that will be people off services. Some of it will be the hospitals shifting costs. Some of it will be programs that get cut. Some of it will be providers that don't get paid as much, so they no longer provide the service. No one knows exactly where the shrapnel will fall, but it will be a very large change to our state budget and the services that we can provide. So I'm really hoping we can find some other better way forward.
Thank you, Representative Ward or Dr. Ward. Thanks for carrying both of those titles. We think the number in Washington is 3 billion, but so it makes sense that Utah would probably be 1 billion. We'll next go to Ken Leonard, Executive Director of the North Carolina Association of County Commissioners.
Thank you so much, Senator. I could echo a lot of the things that the other speakers, especially Steve, has mentioned, but I appreciate the opportunity to give you the perspective from North Carolina and our counties here. In North Carolina, our county departments of social services, they're on the front lines of delivering critical public assistance like Medicaid and SNAP. Our organization, which is a nonpartisan organization, represents all 100 of our counties. So I want to be clear that our members care deeply about supporting our residents that need these benefits and at the same time making sure that these benefits are used most effectively and efficiently. Our deep concerns about the revisions to the eligibility checks and the work requirements for Medicaid and SNAP are rooted in the administrative strain and pressures that these changes are going to create at the county level. In North Carolina, our counties administer Medicaid and SNAP on behalf of the state. We're a county-delivered, state-supervised system, and that means when eligibility checks increase, it's our county staff who must perform that level of work. So the proposed provisions would require more frequent and intensive redeterminations of eligibility, including verifying work requirements, income fluctuations, and reporting changes with little or no administrative funding to come along with those requests. So from our standpoint, this is a pure cost shift to the North Carolina counties. It's an unfunded mandate from the federal government down to the county governments. And county budgets in North Carolina are going to feel the impacts of these changes. And in North Carolina, counties can only raise revenues through property tax and sales taxes. And of course, the other option includes cutting programs that currently exist. So our DSS teams are already stretched thin. The vacancy rates for eligibility caseworkers are high, caseloads are heavy, and the new mandates in this bill will significantly increase workloads without adding the tools, the technology, the time, and the resources to do that job well. I feel like I need to say this again because I want to make the point that this isn't about resisting work requirements for a lot of our members. It's really about ensuring that we don't break down the systems that we rely on to serve the most vulnerable people, like the children, the seniors, the local low-income workers, while trying to enforce those requirements that are being asked of us. So we appreciate all that you're doing. We would ask that your colleagues would pause, reconsider, and at a minimum target flexibility for states like North Carolina, where counties administer these programs. In North Carolina, we say if you've been to one county, you've been to one county. And you can just apply that to states. If you've been to one state, you've been to one state. So we all need the flexibility to adjust to these changes. So, Senator, thanks so much for the opportunity to share the viewpoint from North Carolina. We appreciate your efforts.
Thank you so much. Thank you for that articulation. We'll now go to Wendy Sisk, who is the CEO of Behavioral Health in Washington State out on the Olympic Peninsula.
Thanks, Senator Cantwell. I appreciate you having me on today. So we are a community mental health center in Port Angeles, Washington, and our role is really just to serve people predominantly with serious and persistent mental illness. Illnesses like schizophrenia, bipolar disorder, and people with substance use disorders who are at grave risk of overdose. Medicaid's really the backbone of the community behavioral health system. And because of the conditions we treat and the level of disability that our participants have, more than 85% of my organization's budget comes from Medicaid. And the way this bill is structured, we would anticipate somewhere between like a 25 and 45% cut in our Medicaid revenues if this bill were to move forward. We don't have the same robust private insurance payer mix that Dr. Ward alluded to that many clinics have in the healthcare system. Community behavioral health is really largely dependent on Medicaid services. So if this bill moves forward with these Medicaid cuts, it would just be devastating to the community behavioral health system. The safety net behavioral health providers would probably be forced to lay off staff. We'd have to close life-saving programs. We'd have to institute wait lists. Smaller agencies would be likely to collapse, resulting in rural areas in our state and across the nation having no access to services, and even urban areas facing serious limits when we see that the need is continuing to surge. And we know from past experience, as was mentioned earlier, that when we don't have robust outpatient services, we see increased overdose deaths. We see increased law enforcement contacts. We see increased homelessness. And people have to access care in the most expensive and traumatic places, such as emergency departments, jails, and inpatient facilities. You know, right now, I'm heartbroken each day. I'm getting calls from participants in our programs asking if they lose their Medicaid, will we still help them? People call and say, if I lose my Medicaid, am I going to get kicked out of my housing? What am I supposed to do? It's distressing because we've made a lot of progress in the last few years in stabilizing the outpatient behavioral health system. And this change has the potential to totally destabilize all that work that we've done. Our staff are overburdened already, adding additional requirements to help people with additional eligibilities. It's a lot of extra work on our end as well as at the state level. So we serve one of the most vulnerable populations in this nation, and this bill would likely unravel huge strides that we've made and cause life-saving services that we provide to our community to be extracted. So we appreciate, all the senators and representatives who are trying to protect care for these most vulnerable citizens in our communities. Thank you.
Thank you. And Wendy, you guys attacked that problem to deal with the fentanyl crisis, right? You built more capacity in your community
Absolutely.
to help fight the fentanyl crisis. So
Absolutely. And we're seeing those numbers of overdose. Clallam County used to be one of the highest overdose counties in the state of Washington, and we have moved far down that list in part because of our efforts to reach out to people and engage them in that life-saving care.
thank you. Thank you for that. Our last speaker will be Tristan Tuwig, who is from the emergency department, registered nurse at Providence Sacred Heart in Spokane. Tristan, thank you.
Thank you, Senator Cantwell, for your continued leadership and for protecting patient care and for inviting the frontline healthcare workers into this conversation. Yeah, my name is Tristan. I'm a board-certified emergency nurse in Spokane and represent the Labor Executive Council for the Washington State Nurses Association. And I'm here on behalf of, I think, of nurses across the state who carry the weight of these policies in real time with real patients. And in the emergency department, I don't think we see just patients. We see people in crisis, and we see patients who have skipped the doctor's visits because they couldn't afford them. We see older adults whose medications have run out. And we've seen illnesses that could have been treated with a simple prescription, but after delays in care now require hospital administrations. And these cases happen every day, disproportionately more so in some rural areas and in critical access facilities, but they often result in a delay in care of a healthcare system that's already in a delicate state. When Medicaid is threatened, it's not just numbers on a spreadsheet that shift, it's access, it's timing, it's options for patients. And without accessible coverage, people tend to delay care. They're choosing between groceries and medicine. And when they show up to the hospital, they show up sicker and their recoveries are harder. And that could have been managed by preventable diseases in primary care, but often becomes much more complex in the treatments. These delays don't just cost more, they leave patients and families with fewer options. Medicaid remains one of the few systems that helps ensure that some of our most vulnerable neighbors receive the best care based on need. And we want a healthcare system that functions. We have to protect it. We have to protect it for patients, for providers, and for the communities from which we serve. Nurses just want to provide safe, compassionate care. And we believe that the proposed cuts to Medicaid would be detrimental to the people from whom are members of the communities that we care for. So I appreciate your time and I appreciate your initiatives. Thank you.
Great. Thanks so much. So we'll turn to questions now. And Callie, tell us how identify the questions and who they're to.
Hi, thank you so much, everybody. We're going to go ahead and move over to the Q&A portion. We ask that any press who are on and hoping to ask a question, if you use the raise hand function at the bottom of the Zoom screen, and then just type your name and your outlet in the chat function, we will go ahead and go over to you and unmute you. And it looks like we have a hand up from Bradley Warren at KHQ. Bradley, we'll go ahead and go to you.
Hey, Senator, this is kind of going to build on some of the stuff that we've already talked about. I was at your roundtable here, but I also direct this to the nurse from Spokane. With that impact to rural areas, specifically in our region here in Eastern Washington. What would be the biggest concern that you guys have when it comes to not only these cuts, but then the loss of those resources of those smaller facilities? How and where can people get the service if they lose that?
So Tristan, I don't know if you want to say something about Spokane specifically, or if we want to talk about the same behavioral health challenges in, Wendy, that you might see in Spokane. We definitely have talked to behavioral health there, or just the larger, I mentioned our governor has estimated that it would cost our state $3 billion. So we'll try to get an exact number of how many people of the 16 million that would lose Medicaid coverage might be targeted to our state. But we know that the cost that our governor's office is saying is $3 billion. But let's see if Tristan has an idea about access, or if Wendy does.
Yeah, my answer to that would be pretty high level. I mean, we understand that Medicaid is very diverse in the way that it's being utilized, particularly in rural communities or urban. But we can look at 40% of births or 65% of nursing home residents rely on this. So it's a cascade effect. So if there's a reduce in this funding, we're going to see a cascade of effects throughout the entire system. And ultimately, what we're talking about is a community or a population that are particularly vulnerable. And that's, I think, the concern from the nursing perspective.
Yeah, and then I guess my follow-up, I'm sorry not to be clear on the front end, would that then overload the systems in the more metro area because they're taking the service from the rural communities because those smaller resources lost the funding or the ability to sustain?
Yeah,
Well, we
I'll clarify.
think,
Go
yeah,
ahead.
again, well, no, go ahead, Tristan. You're the expert, but obviously we have a very high Medicaid, Medicare population in the city of Spokane. So that makes it, challenging in losing, if, like Wendy was saying, she thinks that's 30 or 40% of her revenue from the behavioral health side. Trust me, I've been into lots of meetings with the Spokane Police Department and the police chief and the firefighters, and they're all overwhelmed over the drug crisis and trying to treat patients. So I don't think anybody can afford to lose any of those services.
And Bradley, if we destabilize the system, what we saw during the pandemic was even our urban centers didn't have the capacity to meet the need any longer. So if we start crippling those rural hospitals, we have a number of rural hospitals in our state and across the nation that are at risk of closing should this bill move forward. And that will flood those patients into the more urban areas who are already at or near capacity. So we would anticipate both on the behavioral health side and the healthcare side that as the rural capacity shrinks, the urban capacity will not be able to keep up. So we'll have people needing care that won't be able to access care.
Thank you all.
Okay, do we have any more reporters who would like to ask a question? If so, please raise your hand and type your outlet and name into the chat function. Okay, hearing none, we will go ahead and pass it back to Senator Cantwell for some closing thoughts.
Yeah, so I just wanted one last time to talk about the Medicaid work requirement, just because we have people who are in our state legislature. Ray, you touched on this, but how do we, I mean, you're going to see a big impact just on the cost of that, right? Like the cost to the state to even set up that kind of system, or maybe it was Kevin that mentioned that. So part of it is just the amount of cost that it takes to set up
Sure.
I don't know if you guys have thought about how much that would cost, but obviously it's an expense in and of itself.
So that is not our biggest concern with respect to the work requirements right now. So Utah, our Department of Health right now is actively pursuing a work requirement waiver, which we started pursuing even before the details went into this bill. right? So we're comfortable with the idea of a work requirement, and our Department of Health is looking into how we would do that and working on putting the details together. Our biggest concern, I mean, there will be some costs. So I don't mean to say that there won't be, but the far bigger concern is how it is implemented. I mean, even basic things, the words on the page turn out to not mean the things they sound like they mean when you say, well, you have to work 80 hours a week or 80 hours a month. It's like, okay, but did you mean to, I mean, does an Uber driver count? They count, right? Oh, no, actually, they don't count because they're not an employee. Well, okay, we're going to create another whole system to figure out, we have a large number of folks in our economy now who make a living and earn money and work, but who are not classified as employees, which is the way our Department of Workforce Services previously judged these things. What about someone who is paid cash because they provide childcare in their home to two other extended family members and they're paid for it, but they are not a W-2 employee? Does that person get to have Medicaid? There's the part in there. I mean, there's a long list. It sounds beautiful that if that list of who would be included, if that's really who is included on a regular basis, that's actually what we're hoping for. But to say, well, you have to show that you have a medical debilitating condition. Okay, well, do I have to pay cash for the doctor's visit to get the note for that? Do I pay for it? I mean, how am I going to verify to you that that thing is met? And how often am I have to going to verify it? Many of those things in there in the current requirements would not work with what we hope to have in our waiver. So our biggest concern with the waiver is that it looks like the current language would in fact not reliably provide coverage to the people who it says you mean to provide coverage to. And then secondarily, less than that, we do worry some about the cost of it.
Okay, great. Kevin, anything for?
Senator, yes. I just wanted to chime in about the cost and perhaps demystify this process at the county level, at least in North Carolina. I think that there are some who think that this is a highly automated system in terms of the eligibility checks and if the work requirements come in to place, how that works. It is not. The technology is really not in place at this time to do that type and level of work. And so we've had conversations in North Carolina that we're going to have to retool the current systems that are in place, software. And that's why it's so, from our standpoint, critically important. If the Congress is moving towards these things, there has to be time. There has to be time put in place to allow for the counties to get ready for this, not only from the workforce capacity issue, but from the technology. We say in North Carolina that counties are the front door to democracy. People are literally walking through the county door, and particularly in our DSS office, to interact with the county employee to determine that eligibility or to get the benefits. And so it's not a flip of a switch that's going to turn all this stuff on. There's just going to need to be time and retooling of these systems to allow for such changes to occur. So thanks for letting me add into that.
Yeah, well, thank you all very much. We're going to keep fighting here. We're going to keep trying to get this right. We like Medicaid coverage to continue and to be strengthened, and really appreciate everybody's participation today and explaining the impacts on the ground in your individual states. So thanks, everybody, and we'll keep you posted on what happens here today.
Thank you.
Thank you.
Thank you, Senator.
Thank you.
Thank you.